Welcome back to Little Growing Moms. Join me as I dive into the mystery of Blount's disease. So in this video, you'll explore what Blount's disease is, its symptoms, and why it's important to identify and treat it promptly. So my name is Judith Nasazi. I'm a pediatric orthopedic surgeon, and welcome back to this channel. So Blount's disease can have a profound impact on the children's lives, affecting not only their physical health, but also their mental well-being and their self-esteem. So if it's left untreated, it can lead to serious complications that last a lifetime, making it crucial for parents or caregivers to be aware of the signs and symptoms of this condition. So awareness is key, and that's why we're talking about it today. So what is Blount's disease? Blount's disease is a condition that affects the growth plate of the tibia bone, causing it to develop abnormally. This can lead to a range of symptoms from both knees, knee pain, difficulty walking, and many more. This is the model of the tibia that I do have here to describe what Blount's disease is. So this is a sawbone model of the tibia and the fibula. These are the bones that make up the lower leg. So the top of the tibia has in children has an area called the growth plate, and this is the joint surface, and this is the metaphyseal region. So when someone has Blount's disease, the growth plate on the inner side of the tibia is sick, and therefore it is not functioning or growing at the same rate as the outer side, and this predisposes to the bone to sort of grow outwards faster than it is growing inwards, and therefore ultimately the child ends up with a bowed knee. Ultimately the child ends up with a bowed leg, because this side is growing at the normal rate, but this one is growing very, very slowly. So we say that the growth plate on the inner side is sick. It's a sick growth plate, and that's how Blount's disease comes about. Okay. We'll go over some of the risk factors of Blount's disease. All the exact reason isn't fully understood. Some risk factors that increase the risk of developing Blount's disease are known, and these include early walking. So children who walk quite early stand a higher risk of developing Blount's disease, and this is normally children who walk maybe at 9 months or earlier. Another is childhood obesity. So the extra weight has been said to put pressure on the legs, increasing the risk of bone-related problems. Another is genetics. So if someone in the family has Blount's disease, there may be a higher chance of the child developing it. Sometimes it's because of uneven bone growth. So the growth plate doesn't develop properly, which leads to bowing of the legs. One of the most significant risks of untreated Blount's disease is the development of deformities and disabilities. Children may have trouble walking, running, or engaging in physical activity, which can lead to a feeling of frustration and isolation, so affecting their overall quality of life. So now let's talk about the symptoms. The main sign of Blount's disease is bowing of the leg, which becomes more obvious as the child grows. Some other symptoms include one leg appearing more bowed than the other. They have knee pain and difficulty walking. There could be a change in the walking pattern, like they could start limping or just have an awkward gait. Sometimes you notice that there's a limb discrepancy. Also, when they're walking, you notice that their foot turns in quite a bit. So we call this in-toeing. And they could also walk with a lateral thrust. So diagnosis typically involves a combination of physical examination, imaging studies, and a medical history review. Early intervention and treatment can make such a difference. By identifying Blount's disease early, the doctors can develop a tailored treatment and plan out how to correct the deformity and plan out how to prevent the further progression of the condition. So now let's talk about the treatment options. This involves physical therapy, surgery, bracing, to mention a few. So the goal of all this is to restore normal growth and development, ensuring the children can lead an active and healthy life. Unfortunately, many cases of Blount's disease go by undiagnosed, leaving the children to suffer silently. It is essential that we raise awareness about this condition, encouraging parents and caregivers to seek medical attention if they suspect something is wrong. So by working together, we can make such a difference in these children's lives. So the treatment of Blount's disease depends on the severity of the condition and the age of the child. So mild cases may not require treatment, while the more severe cases may necessitate surgical intervention. Physical therapy can work, and together with bracing can be effective in managing the symptoms and promoting normal growth. So it is essential to work with a health worker to provide a comprehensive treatment and plan out how to address this problem for this child, and it's tailored based on the child's it's tailored from patient to patient.
Happy birthday! Thank you. Hi, sweetheart. Hi. You look beautiful.
So while Blount disease can be challenging to diagnose and treat, there are so many success stories out there. One such story is of Amira. Amira is a 9-year-old girl whom I saw last year, and her mom was very frustrated by the appearance of the leg that had progressively been growing outwards. We were able to treat her, and she's now running around with her friends and being happy and looking very good. So early intervention was key in Amira's case. It is testament to the importance of awareness. It is a testament to the importance of awareness and education. Identify the condition early, and Amira's parents were able to seek medical attention, ensuring that their daughter received the best possible treatment. So it is stories like Amira's that inspire us to keep talking about Blount disease and raise awareness about it and promote education about it like I am right now. In summary, Blount is a condition that affects the growth of the children's tibia and ultimately causes bowing of the leg. It can affect the physical and emotional state of the child. When it's detected, it can be treated, and that can help avoid long-term complications. So that's all for today. Don't forget to leave your thoughts in the comments below, and if you're interested in learning more about childhood health issues, be sure to check out other videos. And until next time, keep it on the dog grandparents.